Kristin O'Connor. Ms. O'Connor is the Section Chief for Child Welfare Policy and Programs at the North Carolina Department of Health and Human Services. Since receiving her graduate degree in prevention science from Harvard, she spent 25 years in leadership, responsible for the development and implementation of prevention-focused programs. She's directly responsible for the oversight of North Carolina's CAPTA state plan and prevention services within and across North Carolina's child welfare system. So let's give Ms.
Great. Well, thank you so much, everybody. My name is Kristin O'Connor, as Jenny mentioned. It is an incredible privilege and honor to be before you today to have this important conversation about preventing child maltreatment. I work, as Jenny mentioned, I work for the North Carolina Division of Social Services in our Child Welfare Services section within the Department of Health and Human Services. But everything that I'm about to present to you has been a result and continues to be a result of really great work that's happening in partnership with other state-level partners, and most notably our Division of Public Health under the umbrella of the Department of Health and Human Services, Triple P America, the Duke Endowment, which is a philanthropic organization that serves North Carolina and South Carolina. We also have Prevent Child Abuse in North Carolina, and the Impact Center at Frank Porter Graham Child Development Institute at the University of North Carolina, Chapel Hill. All of us coming together to really think about the public and private investments in child maltreatment prevention. I'm going to highlight for you some of those investments that we've been making with respect to the scale up of Triple P in North Carolina. And I'll give some background certainly on Triple P as well. I also want to make note that this is a timely conversation because CAPTA, Title II of CAPTA, as I'm sure many of you know, is Community-Based Child Abuse Prevention, CBCAP, and you may hear it referred to as. And CBCAP in North Carolina really is a very important driver for us in the child welfare space. And so it is really the only source of federal legislation that provides funding for primary prevention of child maltreatment. And it's also one of the only federal sources that allows for capacity building at a state and local level to really invest in the supports that are needed to ensure that programs and services and interventions are being delivered with intended outcomes. And that's really important context for us as we think about what we know works in the field of child maltreatment prevention and prevention science as a whole. In addition to being the state child welfare lead agency, certainly we have responsibility for administering Title IV-B, Promoting Safe and Stable Families funds under the Social Security Act. We also serve as the CBCAP lead agency for North Carolina, and we, being the North Carolina Division of Social Services, are also the administrative home to the North Carolina Children's Trust Fund, which is a source of state revenue for primary prevention of child abuse and neglect. Much of the work that we've been doing in the prevention space has really been informed by what we know the science tells us works in terms of yielding outcomes for children and families. And so one of the biggest takeaways is that what we know works is that the focus of the quality of the implementation of a program is extremely important. We spend a lot of time talking about the evidence-based programs that are out there, and there are many. There are lists that have many of those evidence-based programs. But what we also know is that an evidence-based program, if it is not implemented well, can actually yield poor outcomes. It can do harm for children and families. Conversely, we also know that if you have a program that has less evidence, for example, but it's implemented really well, we've taken really good care of the capacity and the supports needed to make sure that program is implemented well, we would actually potentially see better outcomes than the evidence-based program that's poorly implemented. So we're really helping to craft our work around what we know by the science is important to pay attention to for outcomes. As Jenny mentioned, the costs of child abuse and neglect are extremely high. We can also really see really important yields and returns on investment when we implement with care, when we implement things that that are known to work through the science of implementation. That's going to be an important grounding point for us as we work through the next few slides. So how is this working in North Carolina relative to Triple P? We implement many programs in North Carolina. Triple P is not the sole program that we're really helping to use these lessons learned from, but it is probably one of the most magnificent examples, in my opinion, in my career, of a true public-private partnership coming together with a focus not so much on the actual evidence of the program, but on what we know works in implementing that program well. CBCAP it's the positive parenting positive parenting program system of interventions. It's a population-level program that's designed for families with children 0 to 16, having an array of different needs. And we see outcomes that are important to increasing parental skills and knowledge and their confidence. We see important outcomes related to helping to prevent children's emotional and behavioral and other developmental concerns. We also see from the research in CBCAP that it can actually reduce the incidence of child maltreatment in a community. It has 5 different levels of intervention, and what's great about this is that we know that not all families are the same, not all agencies and staff are the same in implementing programs. So what's beautiful about CBCAP is that it allows us to really meet and tailor to the needs of the family. And we also know that from the research, and we have a real notable study out of South Carolina, the U.S. population trial CBCAP that was published in 2009, that shows when you are implementing all 5 levels of CBCAP in a community, when you have that saturation happening, and you are going to actually see, and we did see, reductions in substantiated child abuse and neglect. We saw fewer out-of-home placements, so fewer children coming into foster care, and also reductions in childhood injuries that were resulting from child abuse and neglect. And so in North Carolina, we are working collaboratively with the partners I mentioned earlier to bring to scale CBCAP in North Carolina. And you can see here that we have a pictorial here of different clusters of work. So we are organizing our work into 10 coalitions, and each coalition is serving a region of counties. And the coalition is being supported and led by what we're calling the lead implementing agency, and that's represented by the dot on the screen and on the map. And so these lead agencies are responsible for helping to support and grow the capacity of a community to implement CBCAP, to make sure that the service agencies in that coalition or in that cluster are also receiving the needed supports and enhancements to ensure effective delivery of the intervention, so that at the end of this, the children and families receiving the benefit are really getting quality, fidelity implementation of an evidence-based program. This tiered model of support, implementation support, is really the crux of the public-private partnership. So within each of those regions, you can see that we have a scaled model here that leads us from the top of state-level support all the way down to the parent and family level. And in between that, you have the lead implementing agency that's providing support to the service agencies. And when we're growing that capacity, when we're helping to support that work, then we can see that the practitioner delivery of CBCAP is actually better and stronger, which is going to yield outcomes for children and families. Also, what we're building to support is a CBCAP support system. So anchored by these 3 agencies here, CBCAP America, the Impact Center at Frank Porter Graham, and Prevent Child Abuse in North Carolina, who are coming together as intermediary organizations, providing capacity support, implementation support at the state and regional level to make sure that we have the infrastructure needed to do this work well. And we do all this under this theory of change that getting to outcomes really is not about scaling one individual program on its own. Evidence-based programs are fabulous, but we can't scale them individually. So if you take a look at a population level approach to what we're trying to do with CBCAP, for example, we can see that when you're building community capacity, when that's strong, when that lead implementing agency has capacity to provide support in the region, then the service agencies that are a part of that coalition, part of that network, are also building their capacity. And when you have community and agency capacity, then you have practitioners who are able to deliver the services with much more integrity and fidelity to the model. And when you have fidelity, you get outcomes for children and families. So this is additive, but it's also synergistic, that we can't have these without each other, and one leads to the next. And so here's an example of what's happening in one of our coalitions in North Carolina. In Wake County, which is in central North Carolina, we have data here, and I'm just going to make sure I get my slides so that I can not miss important parts. But we have work through the Impact Center at Frank Porter Graham Child Development Institute has really been monumental, and again, in partnership with all of the agencies that I mentioned earlier. What we're actually doing is measuring the community capacity of our Triple P coalitions and of our regions and the service agencies that are implementing Triple P. And so with the development of a community capacity assessment really helps us to measure the capacity of a community to implement Triple P and to scale it up. And so represented here, you see 4 6-month interval administrations of the community capacity assessment beginning from November 2016 leading into June of 2018. And really the takeaway here is that we can see measurable improvement in both the local capacity to implement Triple P through coalition agencies, but we also can see that the indices on the bottom of this slide in terms of fidelity and the use of data, as well as the ability to have what we call facilitative administration, so the internal policies and procedures of an agency that either help or hinder the ability of an intervention to be implemented, as well as the external factors, the external system factors that can help or hinder the ability of an agency to deliver Triple P. All of those drivers of implementation are improving with the support that we are providing through the structure of Triple P that we've been doing in North Carolina. We also have a community implementations driver summary index in blue at the far right of the slide, and that's really just an aggregate of many of the measures together that measure both the coalition, the lead agency capacity to support the community, as well as the service agents, their ability to support the service agencies and the delivery of the services as well. And so we see marked improvement and growth in all areas of that work. And these were just a few of the indices. There are 11 indices of that community capacity assessment and 3 summary indices. So this was just a snapshot to show you that the investments in that public-private partnership, but more importantly, the investments in building community capacity as a component of implementation is really very critical. That when we think about implementation, we often think of the frame of we have to do or to deliver. And in this context, in the prevention science, implementation is about supporting the use of. So we're supporting the use of by growing capacity and performance to make sure that we can then deliver an intervention with fidelity, which will then lead to outcomes. And I cannot stress the importance of CAPTA in really providing a framework for us in the states to enhance the capacity and the public-private partnership work that we're doing to see these types of outcomes. We talk about innovation. We have lots of great programs being implemented around the country, around the world. But those programs in and of themselves are not going to reach population level saturation. And population level saturation won't happen naturally. It won't happen by itself. Getting to outcomes is not going to happen without a real intentional focus on investing in what we know works for building a community's capacity to do the work at a local level. And so with that, I will close my comments, and on behalf of North Carolina and the children and families that we serve, thank you so much for the opportunity to talk with you today.